Hi there, I'm Dr. Miles Berger from the Duke Anesthesiology Department, and thank you for taking the time to watch this video that will tell you a little bit about the ALADDIN study that we're doing here in the anesthesia department. And the reason we're doing this study is that we've studied anesthetic drugs for a long time, and we have a pretty good idea now about how they affect the brain and how they sort of change brain activity. One thing we've noticed in recent years, though, is not everybody's brain responds to anesthesia the same way. And that's not surprising. This is true for most drugs, that not every patient, not every person responds in the same way. Our group has developed some preliminary data over the last few years that suggests that some of these individual differences in how people respond to anesthetic drugs may actually be a good way of predicting who's at risk for getting confused or delirious after surgery, and they might even be a good way of predicting who's at risk for getting Alzheimer's disease or dementia far longer down the road, 5, 10, 20 years in the future. The reason we think all of this is important is we don't have great drugs for treating dementia or treating Alzheimer's disease once it already happens, but we do have good strategies to prevent these problems beforehand. And so if we could predict beforehand who's at risk of having these problems, that would do a great deal in terms of helping prevent them. So that's the basic underlying idea of the ALADDIN study. And the study involves basically 4 parts that you would undergo as a participant. The first part is thinking and memory testing. These are simple tests with a paper and pencil. You would do either with our staff here in person or remotely via Zoom or a similar sort of online platform. And these tests are a little bit challenging, but we just ask people to do their best. There's no competition between patients, and we don't post the information anywhere. The second part of the study is getting some fluid samples from you before surgery. This means a small sample of your blood, just a few teaspoons. And we use the smallest needle we possibly can so this doesn't hurt. We use sterile techniques, so we really minimize the risk of infections. And then we also get a sample of the fluid from your lower back. Now, when I say a sample of fluid from your back, a lot of people think, oh my God, that means a spinal tap. That's going to be so painful. And I want to reassure you, what we do is very different than that sort of mental image that a lot of folks have. The first thing we do is we spray the back with a sunburn pain relieving spray, something with a medicine similar to lidocaine in it. It's a little cold. We spray that on the back. We let that soak its way in for 5 to 10 minutes to try to really numb up the lower back. Then we inject a little bit more lidocaine, that numbing medicine, with a really small needle. In fact, it's a smaller needle than we even use to place IVs in babies here. And the procedure is very safe. We use clean, sterile technique, and the risk of having any kind of problem like a headache afterwards is very, very low. We've been doing studies with this procedure for a long time here at Duke. We've done well over 1,000 of these for research at this point, and our rate of folks developing a headache afterwards is less than 1%. And even when they do, it typically gets better on its own. So it's really not anything you need to worry about. And similarly, there's nobody who's ever been paralyzed from us doing this. Where we're going in the lower back is beneath the level of the spinal cord, so there's no chance of injuring the spinal cord or anything like that. We only have board-certified anesthesiologists who are on faculty here at Duke University Medical Center and Hospital do these procedures, so you can rest assured you're in very, very good hands and very confident hands when you're undergoing these procedures here. The next part of the study, the third part, is a cap that we put on your head that measures your brain waves during the surgery. And that lets us see, are you showing kind of a normal brainwave pattern in response to anesthesia, or are you showing a little bit less of a usual pattern? And the cap has a bunch of little holes in it. We put a little gel in each one of those holes so it can make a good electrical contact with your scalp and measure the electrical activity that's coming out of your brain, i.e. your brain waves. And then finally, the last portion of the study is getting a picture of your brain as it's actually working in something called an MRI machine, or magnetic resonance imaging. And this also is painless. You just lay flat on a table, and the machine is shaped like a big donut. And the machine slides you into the donut, so your head is in the center of the donut. It's not so tight, though, that it touches you. Nothing will touch your head. And the machine takes pictures of your brain, and it takes pictures using magnetic forces and so on to look at how the different parts of your brain are working together in real time. And that gives us important additional information about your brain that we can't obtain from these other methods. It takes about an hour, so it is a little bit of time laying there. There is a risk of having any metal in the room, especially if it's magnetic. So our study staff will go over things very carefully with you to make sure you're not bringing any metal into the room and you don't have any unsafe metal implants in your body. So we've basically talked about the risks already of the study. What we haven't talked about yet is the benefits in a larger sense. And the benefit is really that if we could predict who's going to get confused after surgery or who might be at risk of developing dementia down the road, not from anesthesia or surgery, just if we could predict who was already on their way to develop those things ahead of time, perhaps 10 years, 20 years down the road, then we could do things to intervene to lower those risks ahead of time. It's better to prevent dementia and it's better to prevent delirium than it is to try to treat these disorders once they've already happened. And so our hope is that the results of this study will help us learn how to use anesthesia in surgery and our ability to monitor it with brainwave recordings during the surgery as a form of a stress test to help us predict who's likely at risk of problems down the road, and that could really help us prevent it. Because ultimately, that's the goal of all of our work, is to help older adults live full, happy lives, both physically, mentally, cognitively, and emotionally. So thank you again for your time, and we'll be happy to talk to you more via email or the other links in the Epic or MyChart announcement that you've received.